Welcome to another broadcast of I Am AAPC. Today I'm with Angela Trautman. How are you, Angela?
Oh, I'm doing great, Alex.
Good. I'm excited to hear about your journey as a nurse who transitioned into the medical coding world. So, would you tell us a little bit about your history as a nurse and then what led you into this new career path?
Sure. So I actually started out my medical career as a medical assistant and then went to nursing school where I obtained my license in vocational nursing. So from there, I focused on family medicine, ear, nose, and throat, head and neck surgery for many years, and I enjoyed direct patient care. But an offer came in to manage clinical programs for a large hospital system in the area, and I answered that call. I did that for a few years, but I always knew that I wanted to maybe broaden my horizons. I just wasn't sure how. So I went from, direct patient care to managing these programs that established best practices across the system and, working with doctors, administrators, and the such.
Okay. So, had you ever had your eye on that administrative side while during clinical care? Was that part of your vision then?
Truly, I was exposed to it because working in especially family practice, you kind of are a Jill of all trades. So I would often take care of patients and then also be the one to fill out the referral and have to use proper diagnosis codes or help the physician fill out orders for x-rays and such and have to put down the proper CPT code. So I was exposed to it, but I didn't in the beginning. Expect to end up where I am today.
Well, as a nurse, it seems uncommon for a nurse to have their hands in diagnosis codes. Is that uncommon or is that typical?
It is a little more common today. If you work with family practice docs, then you may be familiar with the codes that are marked on sheets to explain diagnoses to patients. You may see them working with specialists. Oftentimes, we are the ones that will give patients information for surgery, and there are standard forms for that as well. So you do get pretty acquainted with repetitive diagnoses and procedures that may be specific to the practice you're working in.
Okay, okay. The role that was offered to you
Mhm.
that led you out of the clinical side, what was that role or job title?
So I was the manager of clinical programs, and I had a team under me that together we would organize and track meetings for physicians across the system and actions that came out of these meetings. We would have to then collaborate with other departments in order to establish these best practices and make sure we had everyone on board.
Okay.
It kept us busy.
Yeah, oh, I'm sure. I'm sure. And it sounds like, man, I gather this from a few nurses that I've spoken with. When you transition from, or for many of them, and it seems like for yourself, you don't end up in a pure coding role.
No,
Okay.
no.
And have you ever had a pure coding role?
So I do now.
Oh, you do now. Okay. All
I
right.
do now. So from the clinical programs manager position, by chance, I had an encounter with the medical coding team, who at the time was wanting to be trained on Zoom so that they could offer webinars and schedule meetings with providers to give one-on-one guidance as far as coding and documentation goes. So I was the designated Zoom super user for my department, and I happily offered to give them some overview and training and practice as far as setting all of this up. So in those training sessions, I would hear them talk shop, and I started asking questions and became more and more interested in becoming a coder. So with their guidance, I joined AAPC and enrolled in classes and have since earned my CPC, my CRC, and my CDEO.
Wow. You're
Yeah.
collecting those credentials, Angela.
I am, and those are ones that are specific to the role that I'm in now. And so I wanted to be sure that I would be able to accurately provide guidance to the providers that I encounter now. I've been in this role for 5 years,
Okay.
and as you know, coding is an ever-changing field and staying on top of it is super important. And AAPC has helped me do that.
Awesome. Angela, how long were you a clinician for?
Oh gosh, I was a clinician for 12 years.
12 years. And then that first job in an administrative side, how long did you work in that space? Because I'd imagine you might have had several different jobs in that space before you
Mhm.
earned your CPC.
Yes, so I went from direct patient care for 12 years into management for 6 years,
Okay.
and then became very interested in transitioning again.
What is that like? What is the coding world like? And has it been difficult to grasp all of it?
Truly, it has been a blessing to come from the medical field into coding. Medical terminology has been hardwired in me, and rationale behind the guidelines was easy for me to grasp. Of course, there were challenges and new codes and guidelines that I hadn't seen before, but having that background really did help me as far as the courses and the exams.
Okay. How about day-to-day work? Do you feel yourself going back into nursing mode at all, and not as a patient care, but relying on some of the things that you'd learn as a clinician or even in the administrative side from
Oh,
before?
absolutely. Absolutely. So, in my current role, I review medical notes to validate diagnoses. And I also will review, on bigger projects, QA for other providers that are outside of our system. So in doing that, being able to review the notes from a medical perspective and understand rationale, and then communicate back to providers in a way that will give them the information that they're looking for without guiding them to a particular diagnosis or documentation that would be expected has been pretty easy because I kind of understand both sides.
Yes, yes. How you know how difficult the CPC exam can be.
Oh, yeah,
And with your background, you mentioned this that medical terminology and anatomy that was hardwired into you, so you had you could fast forward right into more in-depth coding and not
sure.
have these prerequisite type of trainings.
Yes.
Um, what was the most difficult about your preparation for the CPC exam?
For me, it was the cardiology section. I'd never been exposed really to, much outside of the basics. And so delving into uh, cardiac surgeries and the guidelines and procedures and the codes that go along with that was really challenging for me. And that's the area that I had to study the most in order to prepare for the exam.
Is there any advice that you'd give to a clinician or a nurse who's watching now that may be thinking about diving into the CPC preparation? What, how would you encourage them to manage and tackle their curriculum?
Truly, I would take notes on the things that you're not sure of. Some things you will just glide over because you've been exposed to them in the past, but there are going to be new concepts and procedures that maybe you haven't been exposed to. Take notes in your books. They are your books to use as reference. So write in them. They don't need to be pristine once you put your hands on them. That was a huge help to me in studying and also preparing for the exam.
Had you had much experience, hands-on experience with the code books as a clinician?
I had, as a medical assistant, funny
Okay.
enough, because I did referrals to other physicians. And so, in doing those for insurance companies, we did have our giant books right there on the desk. But since then, really, I hadn't until I started studying for the CPC.
I'm sure when you first saw those books, you thought, how do I even manage this? How do I even navigate through and find what I
Yes.
need?
Yes, I picked them up and I flipped through them and thought, oh, I don't know if I can do this. But of course, I stuck with it because I'm a student at heart and wanted to know more, and became familiar with the books through the studies and the courses that are offered.
Okay, all right. And that the CPC exam itself,
Mhm.
was it as difficult as you thought? Did you feel well prepared? What was that like?
I was nervous. I mean, I think most people go into exams a little nervous, but with the resources that are available, I did feel as prepared as I could be. There were still challenges. The test is not easy, um, but passing the exam, you know that you are fully prepared to go into the coding world. So it was definitely a challenge, but taking the practice exams was huge for me, and putting notes in my books was also helpful.
Okay. I'd imagine the practice exams gave you an idea of where you stood in your preparation.
Exactly. And so after the practice exam, I would take notes as to where my challenges were and where my strengths were. And I would focus on what I needed to in order to pass the exam.
Okay. And other than the practice exams,
Mhm.
did you purchase any other resources to prepare you? Were you self-study? What course did you take, Angela?
So I did do the online formal course. I did have an instructor. The workbooks were very helpful. I had my guidelines, of course. Um, I did search online, for more in-depth information on things that I had a challenge with just to kind of better understand it. But between the workbooks and the practice exams, I really think that those prepared me well.
Okay. All right. And here you are, now coding, and it seems like you've had three healthcare careers.
I have. I
And
have.
are you someone who just some of us like change and maybe get bored with or just feel like it's time to try something new. Are
Mhm.
you that personality, or do you feel like coding is your true calling?
I am one to want to learn constantly. And so when I see opportunities to expand my knowledge base, I take them, which has led me to three very fulfilling careers in the medical field. Right now, I am very satisfied with my role. I enjoy the work that I do. I enjoy the people that I work with. But I do envision in the future I may entertain um, what it takes to become maybe a medical coding educator.
All right, all right. So you're always thinking
Always.
in yeah, I love it. And I love how you brought up earlier that coding is always changing, and
Yeah.
that seems like it would suit you well with new codes every year, new
Yeah.
guidelines, and you seem to embrace that.
Yes. Yes. It does keep me on my toes, which I appreciate. I am charged with documenting changes in a simplified form for the rest of the team. So I do enjoy organizing, learning, updating, and such. So it has become part of my workflow.
Awesome. I'm kind of curious about the work cultures between coding and an administrative side. Well, and we're just going to focus on coding in this situation versus the
Mhm.
clinical side and
Mhm.
in nursing. Um, Do you sense that different personalities might work better in other environments, or how has that change been for you? Because you don't have that direct contact with patients every day.
Right, right. And that was exactly my thought. So if you are a true people person, you may want to stay in direct patient contact forever. I am a people person, but at the same time, I love analytics. And so this seemed to be a wonderful path for me to take. Um, I would suggest that nurses or clinical staff who enjoy and understand patient care, but also have that analytical side may truly thrive in this environment.
What is a day typically like? Do you engage with staff often, or are you just heads down coding?
It depends on the day. There are always notes to review, but after my reviews, I do share my findings with providers. I also reach out to my team if I have a question about a particular scenario because not every patient is cookie cutter and not every diagnosis either. So I do engage my team in that fashion. I do communicate with the billing department as well.
Okay. All right. And you've been a member of AAPC for 4 or 5 years now?
Yes.
That's, okay. And what has that experience been like?
Oh, it's great. We do have local chapters. I also have the freedom of engaging with other chapters online, which is fun. The offerings through AAPC have been super valuable to me and is really how I was able to enroll in other courses and earn other certifications. So the organization itself is one that truly does focus on providing quality material and engaging their members in an informative but also fun way.
Are you actively involved with your local chapter?
I am, they aren't holding as many meetings as they did,
Okay.
but I am still an active member. And since they haven't been super active themselves, I have reached out to chapters across the US
Yeah.
to engage them as well, just to keep up with my learning.
Okay, great. Angela, as we wrap up, first, I just appreciate you so much for sharing your story. What would you say to a nurse who's considering making that move into the revenue cycle side or medical coding?
Don't hesitate to do it. Reach out to departments that you may have interactions with now and talk to them. Get an idea of which path may be suitable for you. And don't hesitate to reach out to AAPC to learn more about their offerings and how you can plug into the coding world.
And if you're watching this, you may be watching it on YouTube or Facebook. Angela and I met from the AAPC Facebook group where we've learned from that post I sent out that there are many nurses who have made that move into coding.
Yes, there are.
Thank you so much for your time, Angela.
Thanks, Alex.
You're welcome.